The decision to place an elderly relative in a nursing home is often a tough one for families. But imagine the horror today when hundreds of relatives woke to the news that a fire had raced through an aged care facility in outer Sydney. The death toll now stands at 4, but more are in a critical condition, suffering smoke inhalation and burns. Some are not expected to survive. The nursing home at Quakers Hill is owned by the Domain Principal Group, Australia's largest privately owned aged care provider. A homicide squad investigation for the New South Wales coroner, said to be a routine requirement, is forensically examining 2 sources of ignition with a high suspicion of arson. Tracy Bowden reports.
It must have been a terrifying awakening. 88 elderly people, some immobile, others suffering from dementia. Suddenly their home is on fire.
When I got there, everyone was busy. The whole street was lined with ambulances, fire engines. There was police running everywhere. It looked like a war zone. On the front lawn, there was 30 or 40 people on stretchers on the front. I was watching people being loaded into ambulances that were severely burned. All their face was burned.
So I said, what's happening? Huh? Is there something wrong? Then came the employees. Papa, we better go outside.
First thing, you just want to know if they're okay, if they got out,
6 minutes after a fire alarm was triggered, help arrived.
This is a firefighter's worst nightmare, turning up to a nursing home where elderly people who can't get themselves out of harm's way. So we've had dozens of firefighters in breathing apparatus working in thick black smoke where they couldn't see their hands in front of their faces. So imagine what it was like for the elderly trying to escape.
because he's got emphysema and he finds it difficult to breathe anyhow, so having a lot of smoke around and being confined to that room, you can imagine the state he was in. So hopefully at the hospital they've looked after him and he's okay.
Apparently it did start in her wing, and because they couldn't tell us where she was, we were quite scared that she was not here anymore.
Sue Webbeck rushed to the home, desperate to find out if her 84-year-old mother was safe.
She has some burns to her arm, blisters on her face, but she's talking and she's with it. She knows what's going on, which is Mum. My mum has 9 lives. She's meant to die years and years and years ago, and she keeps fighting.
I walked around the side of the building and there were people that obviously were unable to move out of bed because they're elderly people, and it wasn't a...
Veteran news cameraman Adrian Munn says he's struggling to cope with what he saw.
Yep, it's the worst. It's horrible. To think that these people were helpless, you know, there's nothing they could do. You're walking amongst people that are groaning with pain. There's people there where they're burnt, see? Their lungs are burnt out, they've had horrific smoke inhalation, their hair's singed, they're breathing that hot air in. You can see how all their mouths are dried up.
94-year-old Esther Koschel was full of praise for the nursing staff.
Some of them were choking from the smoke, but they were really wonderful.
I just quickly did what I can, get everyone out, and the smoke is just overwhelming, but, you know, we got a lot of people out, so that's the main thing.
The nursing home is run by the Domain Principal Group. With 59 residences nationwide, it's the country's largest privately owned aged care provider. The care levels include high care, low care and dementia care. The 3 people who died were in a ward at the back of the complex.
Can I start by saying how sad I feel for our residents and their families on this dreadful day. As you can understand, we've spent our time ensuring that we attended to our residents to get the best of care and the proper accommodation for them, and also to support our staff in what is a very difficult morning indeed.
Federal Minister for Mental Health and Ageing, Mark Butler, says the Quakers Hill nursing home's fire safety systems were found to meet standards during an audit in July.
No issues around compliance with these standards have arisen.
As a result of the fire, 32 people have been taken to 8 hospitals suffering smoke inhalation and burns. 14 patients remain in intensive care.
Well, the investigation is going to be quite lengthy. As you can see, it's quite a significant incident. We'll work with the fire investigators and our homicide squad, and we'll just do a methodical investigation step by step.